This is a presentation on vestibular schwannomas by Nicolette Quinn. In this video, I will talk about the etiology, the pathophysiology, signs and symptoms, physical exam, diagnostic imaging, treatment plan, and prognosis of a vestibular schwannoma. Hopefully, after this video, you will know all you need to know for the boards on this topic. A vestibular schwannoma is also known as an acoustic neuroma. The two terms are interchangeable and are referring to the same type of tumor. A vestibular schwannoma is a benign tumor found on the 8th cranial nerve. They were first discovered through post-mortem exams before advanced imaging was ever available. The etiology is unknown. However, there have been many studies done that correlate an increased risk in people who have a history of loud noise exposure and in those who have past radiation exposure. This type of tumor is mostly seen in adults older than 40 and affects each sex equally. A vestibular schwannoma is rare and it originates from the Schwann cells on the 8th cranial nerve. They are usually unilateral and pose no risk for malignant transformation. In this picture, you can see an acoustic neuroma on the 8th cranial nerve with involvement from the facial nerve. The signs and symptoms of a vestibular schwannoma can start with hearing loss, vertigo, and/or tinnitus. The signs and symptoms can progress to headaches, paresthesias, pain in the cheek, facial nerve dysfunction, and vision loss. On average, patients can have hearing loss for up to 4 years until they are diagnosed. The type of symptoms that a patient has depends on how much the tumor has progressed. Early on in the tumor's stage, the patient will have hearing loss and vertigo-type symptoms. However, the longer the patient has the tumor, the worse the symptoms will get. On physical exam, you may want to perform a Weber test, a Rene test, specific cranial nerve testing specific to the symptoms the patient's having, and a fundoscopic exam. A Weber and Rene test can help clarify which type of hearing loss a patient has. For the Weber test, the patient will report hearing a sound louder in the unaffected ear and a quieter sound in the affected ear. For the Rene test, the patient will report air conduction heard longer than bone conduction in the affected ear. Optometry is a good screening tool for patients that you may suspect has a vestibular schwannoma. The results would be a unilateral sensorineural hearing loss and would confirm the type of hearing loss the patient is presenting with. Imaging for a vestibular schwannoma can include an MRI and/or a CT scan. MRI with contrast is the gold standard and can detect tumors as small as 3 millimeters. The picture here shows an MRI with a hypointense area that is centered on the internal auditory canal. CT scans can be done in patients that cannot get an MRI. However, a CT scan will not pick up smaller tumors and may miss some tumors. There are 3 options for the treatment of a vestibular schwannoma. One option is surgery. Microsurgery is performed and is suitable for those who are younger, for patients who have a large vestibular schwannoma, and for those with significant hearing loss. Any patient presenting with a tumor larger than 2 centimeters should have surgery to remove the vestibular schwannoma, regardless of age or symptoms. Another option for the treatment of a vestibular schwannoma is radiation, and this type of treatment is suitable for those who are not surgical candidates, for older patients presenting with this type of tumor, and for those patients who refuse surgery. The last treatment option is a watch-and-wait approach. This approach is more conservative and is acceptable for those patients who have a tumor that is slow-growing and for patients whose symptoms do not cause significant problems or affect their activities of daily life. The picture here shows microsurgery being done with specific tools small enough to reach the vestibular schwannoma. The prognosis of a vestibular schwannoma is overall good regardless of which treatment option is chosen. All patients with a vestibular schwannoma, regardless of which treatment is chosen, will need yearly follow-up scans to monitor the growth of the tumor. All patients with a vestibular schwannoma need to be followed by an ENT, and those who have surgery need to be followed by the neurosurgeon that performs the surgery. There are possible complications of surgery and of the tumor itself. They are rare, but can include a cerebral spinal fluid leak, facial nerve paralysis, and meningitis. These are the references used for this presentation. Thank you for your time, and I hope you have learned something and enjoyed this presentation.